A hematoma is a localized collection of blood outside of blood vessels, typically caused by trauma to the body. It occurs when blood vessels rupture and blood leaks into the surrounding tissues. Hematomas can vary in size and severity depending on the extent of the injury. Here's a breakdown of the symptoms, causes, and treatment of hematomas. Symptoms: swelling. The affected area may become swollen and appear bruised. Pain. Hematomas can be painful, especially if they develop in areas with a high concentration of nerves. Discoloration. The skin over the hematoma may appear reddish or bluish due to the presence of blood. Tenderness. The area may feel tender to the touch. Limited range of motion. Depending on the location and size of the hematoma, it may restrict movement in nearby joints or muscles. Causes: trauma. The most common cause of hematomas is trauma, such as falls, collisions, or blows to the body. This trauma can cause blood vessels to rupture and result in bleeding into the surrounding tissues. Surgery. Hematomas can also occur as a complication of surgical procedures when blood vessels are inadvertently damaged during surgery. Medical conditions. Certain medical conditions, such as hemophilia, a blood clotting disorder, or thrombocytopenia, a low platelet count, can increase the risk of developing hematomas. Treatment. Rice therapy, rest, ice, compression, and elevation can help reduce swelling and pain associated with hematomas. Applying ice packs wrapped in a cloth to the affected area and keeping it elevated can help minimize swelling. Pain management. Over-the-counter pain relievers, such as acetaminophen or ibuprofen, can help alleviate discomfort associated with hematomas. Observation. In many cases, small hematomas will resolve on their own over time without the need for medical intervention. However, larger or more severe hematomas may require medical attention. Drainage. In some cases, particularly if a hematoma is large or causing significant pain and pressure, a healthcare provider may need to drain the excess blood from the affected area using a needle or surgical procedure. Surgery. In rare cases, surgery may be necessary to remove a hematoma, particularly if it is compressing nearby structures or causing other complications. It's important to seek medical attention if you experience a hematoma that is large, painful, or associated with other concerning symptoms, such as fever or signs of infection. Your healthcare provider can assess the severity of the hematoma and recommend appropriate treatment.